Now, with surgery, I imagine that there are some risks. What is the most common risk opting to do this one?
Yeah, so the most common risk for any bunion deformity is recurrence. And so before it was extremely high, and now, optimizing our technique and fine tuning down to, isolated handful of procedures that we can execute predictably, we're able to reduce that recurrence risk. But it's still, hovering around 3 to 5% statistically across the nation. The second biggest risk of this type of surgery, and the Lapidus procedure in particular, would be what's called a non-union. And so when we're making our cuts, we're taking down a joint. So we're removing the cartilage, we're taking healthy bleeding bone and trying to get those bones to heal together. Sometimes they don't. And every surgeon would admit, they've had a non-union in this area, myself included, despite my best efforts. Incidence rate of that, hovers between 1.7 and 4% statistically. And so it's not common, but it happens. You're going to have one non-union a year pretty typically. That's something that we can address. Sometimes it requires revision surgery, or the patient has to go through it again. But those would be the two biggest risks. The next one would be a post-operative infection or some other complication that we try to account for.